Chateau here with the Physical Therapy Advisor. I thought today we would talk about hip impingement. Now this is a little bit of a complicated topic and there's a lot of variables that can go into how to best treat a hip impingement, and everyone's personal situation is going to be a little bit different, so I thought we would talk a little bit about some generalities, some things that I know for most of my clients are either helpful or not helpful. First of all, hip impingement usually involves pain in the front of the hip, could be inside the groin area. Once in a while you'll get some pain on the side or in the back, but vast majority of my clients tend to have more pain in the front of the hip and in the groin. Things that you want to avoid with hip impingement are activities that are going to really drive the leg upwards, and especially upwards and over. And the reason for that is as the femur bone here, this long bone, articulates forward, it can impinge on the cartilage inside the pelvis. So you've got the ball and the socket, right? And as that comes up, it's catching oftentimes right there in the front of the cartilage, causing that impingement syndrome. And it can be very painful and very limiting for your activity. So oftentimes some of the things that we're doing aren't as helpful as we hope they are, and so we want to really look at this as a big picture issue. Let's address the mechanics while still trying to avoid those things that cause increased pain. So rule number one, do not do things that are going to make it hurt worse. That actually keeps the area inflamed and is going to slow your progress with the rehabilitation. So rule number one, avoid things that cause pain. Rule number two, there's almost always a component of hip strengthening that needs to be done. Typically the external rotators of the hip are weaker and they need to be stronger to help position the hip during the motion. Very similar to the rotator cuff with the shoulder guiding the motion, the hip internal and external rotators can help guide the motion of the hip and ensure that we don't get that impingement. I've got a whole bunch of videos on the channel on how to strengthen the deep hip rotators, and I would definitely encourage you to check those out. So for today, let's talk about which stretches to do and what not to do, and then in the next video, I'll be sure to show you some advanced techniques on how to really get after it with some self-mobilization techniques. So right now, like I had mentioned, what we don't want to do is drive the femur bone more into the edge, that it's called the acetabulum, or where the socket is, where you're getting the actual impingement. So oftentimes we think we want to do exercises like this, where we're really stretching deep, and that you have to be very careful with, because you're actually putting the femur right over that impingement site. This motion can be okay, you have to do it very carefully. What we want to avoid is anything that's going to cross body like this, especially cross body with the rotation. So that means sitting in that mermaid style. So if it's my left leg that's the painful leg, we don't sit mermaid style. Sometimes crisscross will be fine because it actually opens it up. So we avoid things that go internal, and we can usually get away with things that go external. What you'll find is this external rotation will oftentimes be tight as a symptom of the inflammation that's already present. And so you'll want to stretch that a little bit and just to keep the normal range of motion. So simple exercises like this, where we're just opening up, can feel good and be helpful. Just try to avoid that pain that you get that's a real, that exact pain that you know is that impingement. So we can go directions like this. We can even pull it towards us a little bit as long as we don't get our pain. But focus on getting the side of the leg and the hip to open, and avoid anything that's like this, or across the body for the time being, until we get the inflammation and the pain to clear out a little bit. And then, of course, focusing on the deep hip rotators that help guide the motion of the femur. And I've talked a lot about that in other videos. So hopefully you'll find that helpful. Join me here for advanced techniques in just a little bit. And again, be sure to check out my Facebook page at the Physical Therapy Advisor, and also here on YouTube at the Physical Therapy Advisor. Thanks.